Hello, my name is Kyrie Smith, and this is my presentation on a coach's role in dealing with athletic injuries in youth sports. So, for my presentation, I really wanted to focus on improving coaching education, and from that is just talking about the lack of understanding and education that's provided to youth coaches in dealing with athletic injuries and then mental health issues that go along with those injuries. And then at the end, I'll kind of provide my ideas and that I think will believe that will help educate and provide those coaches with the necessary information to help prevent, recognize, provide intervention when an injury does happen. Injuries are on a rise, especially in youth sports, because so many athletes are now starting to play, start at a young age, and then the hours spent playing has gone up tremendously between the last 10 and 15 years. So I really chose this topic because it is something that I am very interested in, and it kind of started when I worked baseball. I'm an athletic trainer, and when I worked a bunch of baseball tournaments within youth sports, and just seeing the amount that a coach is responsible for, not a lot of athletic trainers are present at at those tournaments or just during the season. But luckily, we were able to provide coverage for the yearly tournaments. So, with that said, I've seen how much responsibilities coaches need to have placed on them. Like athletic trainers, we have so many domains. We're not just an athletic trainer, we're nurses, we're mental health counselors, we act as diagnosing injuries, rehabbing injuries, and I feel coaches are the same way. They're not just a coach. They have to lead, they have to manage injuries, they have to provide equipment, they have to do so much that goes in the role of just coaching that is more than just providing wins and athletic performance. And that's the reason, and one of the domains I feel like is very, very misunderstood or lack of information is that injury domain and dealing with youth athletes who have injured themselves, and then that mental aspect and health issues that go along with being injured, especially in a youth setting, can be very challenging because a lot of time this is their first injury. This is the first time they had to deal with something of this magnitude of adversity, of missing time and not being able to do what they like. And the biggest issues I've seen with that is, like I said, is the coaches recognizing the mental health issue and that injury, and then providing support to that athlete so they can kind of stay mentally fit during the process of being injured and during the process of providing that mental health support that will prevent them from having negative mental health issues. So this slide is just a little bit of background, and it kind of starts to support why I think this is an issue. The very first bullet point is the most important one, and that's providing support to an injured athlete who missed a prolonged period of time is extremely important for their mental health. But like I said from the previous slide, the reason why this is a problem is because that lack of knowledge and kind of experience within dealing with athletic injuries, and then recognizing those mental health issues that can go along with those athletic injuries, because most of our coaches within a youth program are parent volunteers or just volunteers like a family friend. These coaches really don't have any formal training or any experience to prepare them from dealing with youth athletes, and especially with youth athletes that get injured, and then, like I said, that mental health aspect and things they can potentially deal with once they do get injured. A coach has a significant role on the outcome of the child, whether it's from enjoyment, self-concept, and just continual participation. A lot of times when, from just my experience, what I've seen, a kid get injured and they really don't have that support to continue to want to get better and continue to play, so they just check out. They get burnt out, and then their injury is the end of their athletic career, which is sad because at a young age, they're still, their minds can be molded to what they want to do. They still don't have that motor skills, and they still don't have that overall cognitive ability to really decide if, hey, I'm really, really good at this. So when that injury happens, you have that disappointment or that letdown that can lead them to just stop playing. And the research that I also found that most of the coaches during the research, they didn't have the knowledge or the training to help recognize and prevent those mental health issues. And then just a kind of a statistic to put in perspective, there's about 30 million youth athletes in a year, and 38% of high schoolers will be injured, and then 34% of those athletes will be injured due to athletic performance. So this slide is the research that I kind of found from an injury and mental health aspect. Year-round, 41 to 60% of football players will be injured. 40 to 46 are wrestling and gymnastics. 31 to 37% of basketball players, and then the lower statistics, volleyball, baseball, soccer, cross country, 7 to 18%. Youth that could contribute to youth athletes spending almost 30 plus hours a week participating in the sport, especially year round with travel ball and not just school play, but also with clubs. And then 1 in 4 of those adolescents will have some type of mental health issues, and 65% of them won't ask for help. So that's where that education from that coach is to recognize some of these signs and symptoms and responses that athletes have to injury, so then they can better help them, because the athlete is not going to want to talk to that coach. And something I kind of left off the slide, but I wanted to talk about, is that athlete and coach kind of rapport, and that what I've seen throughout the research is the better that relationship is between the athlete and the coach, the better the athlete feels more comfortable coming to that coach, talking to him about that mental health issue. 12% of all athletes have experienced anxiety or depression related to athletics before the age of 18. And again, some of these responses: sadness and depression, anxiety, loss of athletic identity, lower self-esteem, isolation, anger, loss of motivation or interest, and then feeling like you let somebody down, whether it's a coach, pressure from a parent, or someone on your team, so teammate. But like I said, that relationship between that coach and that athlete kind of helps the athlete approach the coach. But what we're starting to find is that coaches are typically not comfortable asking or approaching the athlete and getting past that "how do you feel" phase. So they may have knowledge with the area of, some coaches might have knowledge with the area of recognizing the injury or recognizing the mental health issue, but they can't get past the "are you okay and what do we do now" phase that is associated with that. Parents also put pressure on the coach to be more of that mental support during the sport of play, which if a coach doesn't feel comfortable with that athlete, nor do they feel like they have the knowledge, it can kind of just get lost in space, and that support isn't coming from the coach, it's not coming from the parent, and then you have that athlete that's negatively responding to their injury, and then you start to see those mental health issues. And then, like I said, that recognition part, which is very, very important. One of the same study found 87% of coaches witness an injury and allow their players to play on, and 50% of the coaches saw pressure being put on a player, either from themselves, a coach, teammates, or a parent, to continue to play through that injury. And the biggest thing I took from that is a lot of times when, I'm in a collegiate setting, and a lot of times even my coaches, they'll ask me, well, he sprained his ankle. When I was younger, I would just tie my shoe up and then play through it. While that is the case for a lot of people, every injury is different. And not every injury is the same, especially when you are dealing with youth athletes and dealing with different growth factors and how their body's going to adapt. And then their overall just pain tolerance. But when you see that athlete get injured, just being able to recognize, kind of talk to them, what they're feeling, how functional they are, and how they're able to participate without them further doing any damage. And then recognizing that mental health component, like we talked about, of them not feeling pressured, and them not getting that anger, getting that loss of motivation or interest in the sport, because they feel like they just need to have satisfaction from that parent or have that satisfaction from the coach, and now they're playing through injury because of other people and not themselves. and that external motivation. And that's what that loss of motivation and interest of the sport that I talked about earlier, and when they can quit, just becomes kind of heightened. And then that lower self esteem and isolation and anger part and anxiety comes from being able to play through injury but not perform at the level that they were used to, especially when you deal with youth athletes that are more elite. They don't understand that this is why they're injured, and this injury is hindering their performance. So they start to have that sadness and that anxiety to perform and that lower self-esteem, and then they can start to kind of isolate. So that's the reason why I think that education from coaches to recognize those injuries and kind of when to sit down with the athlete and recognize those mental health issues that can go along with it is extremely important with dealing with a youth setting. So another reason why I chose this topic is because there wasn't a lot of research. So I feel like there's more research that needs to be done. But the research that I did found, it was more surveys and self-evaluating forms from coaches, and the researchers asking how the coaches perceived that they felt that they had the knowledge on and how well they can deal with either athletic injuries or mental health issues. However, I wanted to kind of take it from my experience and make it kind of a little bit of both of those mental health issues that are being dealt with because of injuries or associated with injuries, and then just the management of injuries. A lot of coaches from that study had their CPR certification and first aid. However, from my previous slide, they couldn't get past the how do you feel part. They couldn't get past the basic part that, determines whether an athlete can continue playing, whether it's because of injury or because of a mental health issue like anxiety or a mental health block, or them that pressure, them trying to push themselves. So the biggest thing that I think that needs to be done is, like I said, that research and identifying where coaches feel like they're lacking in that aspect of dealing with athletic injuries and dealing with mental health issues because of athletic injuries. And once we can continue that research, identify those coaches who report the lack of knowledge, we can then get things to them, get support to them, whether it's videos, webinars. One thing I suggest is having a governing body among youth coaches, kind of like an NATA manages athletic trainers, like an APTA manages physical therapists. It's just that body that helps coaches maintain that current and basic knowledge that goes along with those domains of dealing with athletic injuries and dealing with the mental health aspect that goes along with just sports in general, and also being injured. I believe all of us get CEUs each year to maintain our credentials and our certification of being certified in our field. So I think we can do the same thing with youth coaching. I know that's going to be a tough battle with them staying motivated to continue to do that while still just being a volunteer or getting very little pay. But I do think that's a great step towards recognizing and giving coaches more education and more knowledge on the subject. Because like I said, coaches are just more than just whistle, cones, and wins. Especially a youth coach who has to provide the physical and mental development of our youth athletes. They should be more knowledgeable, and that in terms meaning us providing them with that knowledge. Like I said in the previous slide, the most important part to fixing this, of what my plan would be for doing research, is to target and find those youth coaches who do not feel comfortable, who do not have the knowledge within that role, stepping into that role of dealing with athletic injuries and dealing with the mental health issues that are associated with those athletic injuries. And from all the research that I was able to do and all the articles I was able to read, the biggest problem, there wasn't a lot of research, and especially there wasn't a lot of objective data, but all the objective data that I pulled from and statistics that I pulled from was from surveys and self-reporting forms of youth coaches taking a survey and reading questions and rating their knowledge and their expertise on the subject that was being asked to them. So if we can find a way to find these youth coaches, and with no matter what sport it is, age groups, find them and give them these surveys and reporting forms to judge their knowledge and what percent of our youth coaches actually need help dealing with this, then we are able to collect that data and provide them, like I said, with that those evidence-based practice tools, the research that will help them better deal with athletes with injuries and better deal with athletes with who deal with mental health issues because of the injuries. So in conclusion, with my presentation, I just wanted to provide awareness and kind of talk about a coach's role with dealing with athletic injuries and mental health issues that are associated with athletic injuries, but mainly because that lack of knowledge and education that is provided to them to deal with that situation. And then I try to give kind of my solutions and the research that I would do based off of the articles and research that I read that I think would help provide youth coaches with that information and knowledge and tools to then better help their athletes when an injury occurs, especially since now, like I said, we have so much high prevalence of injuries because more and more youth athletes are participating. To the right is a link you guys can click on or copy and paste. It's basically the Youth Sports Safety Summit. Every year NTA has this, and it helps provide youth coaches with the knowledge that I talked about regarding safety in sports, recognizing injuries, kind of red flags that athletes shouldn't be playing through. But it doesn't talk about the mental health aspect, which I would like to do more research and provide youth coaches with a better opportunity to do that. But like I said, if they don't know this information is out there, then they can't read it. They can't grab the information. So this is the reason why I put it up here online, but also that's why I think that governing body would help of saying, hey, this is the information. You guys should be knowledgeable or have this amount of knowledge within each subject and domain of that subject with his athletic injuries and then that mental health part. Thank you. My name is Kyrie Smith, and have a good day. Bye.